Hello, I am Dr. Sundeep Upadhyaya, Professor and Senior Consultant, Rheumatology, Immunology at the Indraprastha Apollo Hospitals, New Delhi. A short introduction to the topic of discussion now, osteoarthritis. Osteoarthritis is a disease of the elderly, but not always so. It's always called a degenerative illness or a disease that happens because of damage to the articulating surfaces, cartilage and subarticular bone, but that's not always the case. There are other reasons for osteoarthritis. Trauma and infection are some of the rarer causes. Treatments have been limited to anti-inflammatory medications, exercises, and joint replacements. What is osteoarthritis? Osteoarthritis is a disease of the cartilage, the shock-absorbing structure between the two articulating surfaces of the joints. So you have two long bones that articulate and come together at the joint space. That's where you have cartilage, which is the shock-absorbing surface. The degeneration of the cartilage and the problems with the subarticular bone, the type or the bone just underneath the articulating surfaces is called osteoarthritis. What is cartilage? Cartilage is the shock absorbing surface between two articulating surfaces. It's an avascular structure and is the primary motivation for your ability to walk without pain, your ability to squat, stand for long. Any damage to this structure will cause pain and stiffness. Who is affected by osteoarthritis? Most commonly, it is the middle-aged or elderly woman and very often a man, 60s or 70s, who has knee pain, stiffness, has a deformity, either a varus, which is outward bowing of the legs, or valgus, which is like an L-shaped problem. So this, along with a creaking sound in the joint, pain and bony enlargement with a past history of trauma, with or without a past history of trauma, is the commonest presentation, clinical presentation of osteoarthritis. What are the risk factors for osteoarthritis? The risk factors for osteoarthritis are age, obesity, female sex, and a family history of osteoarthritis. So quite often we have patients, especially women, who describe their mothers with arthritis of the hand joints, typical knobby, bony swellings of the hand joints, and osteoarthritis of the knee. There are patients who've had trauma of the knee and have had major injury to one or the other knee, sometimes even both the knees. And there is that middle-aged gentleman who also is diabetic, is a smoker, and has degenerative spine. That is another phenotype or presentation of osteoarthritis. What causes osteoarthritis? So the causes of osteoarthritis can broadly be divided into genetic, heritable, environmental, metabolic and weight related, and trauma. So the genetic factors sometimes are the most important, and very often you have several members of a family or several generations of family members afflicted with a degenerative osteoarthritis of the knee or the hip. How does one suspect that he or she has osteoarthritis? The suspicion of osteoarthritis is based on some of the history and physical findings. If the patient starts to feel difficulty in climbing up and down the stairs, especially climbing down the stairs, has difficulty squatting on the floor or getting up from the squatting position, has difficulty in sitting cross-legged, then this could all point to the osteoarthritis of either the knee or the hip. Then there is a likelihood that the patient who's had a major trauma to the knee or the hip, starts to develop pain in the late 30s, early 40s on weather change, starts to notice a crepitus or a joint sound. These are features that the patient or the person has osteoarthritis. How to manage osteoarthritis and good living with osteoarthritis. So, the management of osteoarthritis can be divided into primarily the medicines and the physiotherapy. Finally, one may need surgery or joint replacement. The medications that are used for osteoarthritis are primarily analgesics and anti-inflammatory medications. Very rarely will the patient be able to do without anti-inflammatory if the osteoarthritis is fairly advanced. If the osteoarthritis has gone to the extent that the patient needs nearly daily anti-inflammatory or alternate day anti-inflammatory, then physiotherapy, which is muscle strengthening exercises, are essential. The use of a physiotherapist for muscle strengthening and the right kind of exercises is a good idea. And finally, when everything fails, the replacement of the joint or treatment, surgical treatments that offer stability to the joint should be undertaken. To conclude, osteoarthritis is a disease that is not just degenerative, but there are immunological aspects. There are aspects of molecular biology that we are yet to learn. Most often it affects people in their middle ages, and women are more prone to osteoarthritis of hand joints and knees than men. Stay safe, stay healthy, and stay informed. The first set of symptoms you notice for osteoarthritis, meet your musculoskeletal expert, and that could be an orthopedic surgeon or a rheumatologist. There is no need for pessimism. There are treatments for osteoarthritis, and finally, if everything else fails, there is surgery. Namaste.